Hello, everyone. Welcome back to our introduction to CPT HCPCS coding. It's week 7. This is part 2 of 3, where in this video, I will be focusing on the pathology and laboratory section. And just like with other sections, it's all things path and lab, right? Key terms, abbreviations, and being able to code from this section. The pathology and laboratory section of the CPT manual begins with what are known as panel test and continues through to 89398. And then we have these really weird looking codes 0001U through 0520U. The codes in this section represent testing ordered by providers to rule out a disease or a problem, as well as to provide a definitive diagnosis depending on the test results and the symptoms of the patient. Laboratory tests also is used to monitor disease process or measure various substances that could be in the body. Pathology and laboratory codes are more often assigned in the inpatient or outpatient setting. They are not required for billing inpatient services. However, some hospitals capture codes for inpatients to keep statistics on the number of tests that are run. It is very important for the coder to understand how the lab test is performed because, listen, healthcare continues to evolve and laboratory services are constantly changing, improving, and you may need to query the provider for clarification. All right, so let's dig into a few things that you need to know. Of course, this chapter of the CPT manual is further subdivided into the different subsections, which I'll get into them shortly here. But also in this section, you're going to see things like consultation codes that are only used by a pathologist that really reflect the service that they provided as opposed to a test. There are guidelines at the beginning, the green pages, you know the deal. You need to review them. And let's get into the abbreviations. Lots of abbreviations in this chapter. Understanding them are very important. So here are some examples: potassium, lithium, magnesium, milligram, O2 for oxygen, UA, RBC, and WBC. When you get into I like to call the meat and potato of the different sections, you'll notice that there are guidelines that pertain to that particular subsection. You need to ensure that you review them for accurate coding. Well, in March of 2020, the World Health Organization declared a pandemic due to COVID. And during 2020, there were different medical professionals and scientists that treated and developed testing for COVID. And since 2020, there have been additional codes added to the system, and they continue to make changes from year to year. All right, so the first type of test that you will see in the pathology and laboratory section is a panel. And a panel is one CPT code that encompasses a group or panel of tests. So, for example, you see here on the screen electrolyte panel, right? Which is made up of these 4 substances: carbon dioxide, chloride, potassium, and sodium. Now, you'll notice that the electrolyte panel is code 850, but each of these codes or what's in the panel actually has their own codes. So instead of reporting each code separately, if all of these services are being provided, tests are being done, you use the panel code instead of billing them separately. If you bill them separately, the services would hit an edit. The edit would basically be saying that you unbundled the test and you need to use that panel code. Now, you probably are thinking, well, what happens if we do tests outside of the panel? You can code those tests separately. All right, next up, we have drug testing. And drug testing is divided into three subsections. We have the drug assay, and this includes presumptive drug class screening, drug testing, which are tests used to identify possible use and non use of specific drugs or classes. You have the therapeutic drug assay. These tests are done to monitor clinical response to a medication. And then you have chemistry. These tests are completed to determine if a substance is present in the examination material of the specimen. And so, for these three areas, I think one thing that you need to know is that with drug testing, they are looking at is that substance in the body, how much of it is in the body. So, for therapeutic drug assays, there are two major categories. You have the presumptive drug class and a definitive drug class. And presumptive is determining the possible use or non use of a drug or a drug class. And then definitive drug classes are qualitative or quantitative. So, qualitative, is it there? Quantitative, how much is there? Okay. There are some notes in front of this area that you will want to pay close attention to. All right, next up, we have evocative and suppression testing. These tests are also panel tests that are used to confirm or rule out a diagnosis. And these particular codes reflect the technical component of a service. There are guidelines in front of this area. You want to make sure that you check them out. All right, next up, pathology clinical consultations. These codes denote that a service has been performed by a pathologist at the request of another physician or qualified healthcare professional. So, qualified healthcare professional, physician assistant, nurse practitioner. And the request was to provide additional medical interpretive judgment, regardless if the services um, occur at the same or another institution. And you will see that there are a couple of options here. These are divided into or organized based on total time or the level of medical decision making. And so I know immediately you're thinking, oh, it's like the evaluation and management codes. All right. Next up, we have urinalysis. And this particular subsection contains codes for various tests on the urine. In order to code this service properly, you need to know how the test was run. One of the, I would say, frequent tests in this area is a dipstick or a tablet. This is something not like a computer tablet, but the urine is tested with a tablet. um, and basically, it's like for stuff in the office, right? But if a microscope or an automated test is used, you want to capture that um, instead. All right, molecular pathology. So, this particular subsection is used to report medical laboratory procedures that are completed to analyze nucleic acid to detect variants in genes. These codes are organized based on the specific gene being analyzed, and the names of the genes are described as per the gene name approved by Hugo. And Hugo is Hugo, Human Genome Organization. That sounds about right. Okay, there's lots of notes that you need to read if you're going to be coding from this area. Next up, we have MAA, multi-analyte assays. And here they're looking at like DNA and RNA. And basically, um, they're analyzing the human genome. Lots of notes over here as well. So that's MAA. All right. Then we have a chemistry test. And unless otherwise stated, tests in the chemistry section are considered quantitative. Quantitative is how much is in there. The sources or specimen of a quantitative test could be blood, stool, urine, or blood serum. And if the code does not specify a source, that particular code can be used for any sources. Each source is considered a separate specimen. So if the exact test is run on urine and blood, the coder would use one code for the urine and the same exact code for the blood. And when looking at this type of service, you may run across the term analyte, and that's the substance that is actually being tested. Hematology and coagulation. This is where you see the study of the blood. Coagulation is the clotting of the blood. And so here you're going to see services like platelet testing, blood counts, um, clotting factors. So you're going to see tests like prothrombin time, complete blood count, just to name a few. Next up, immunology is the study of the immune system. These tests are testing for allergies and sensitivity to a substance, such as an antibody. You may also see tissue typing and cross matching over here as well. All right, next up, you have transfusion medicine. And transfusion is the direct introduction of whole blood or blood components into the blood stream. Over here, you're going to see codes that include codes for antibody screens, antibody identification, and blood typing. So, to make it plain, you may have heard someone say type and cross. So type, tell me what type of blood type the patient has, and then cross match it for XYZ units of blood. And then we also have blood products for maybe patients who do not believe in transfusion of blood. They may get a transfusion of platelet. Microbiology, study of microorganisms, which involves the identification of organisms. The technique for obtaining the specimen is very important. You're going to see some descriptions in this section that are similar to the immunology section. And you're going to see infectious agent detection. You're going to see words like qualitative, semi-qualitative, just to name a few. Uh-oh, going too fast. All right, next up, you have anatomic pathology. And this is what physicians use to bill for their services for like autopsies and post-mortem examinations. Next up, we have cytopathology, the study of cells, especially in a disease process. Over in this area, you're going to see things like pap smears and cervical screenings. Cytogenic studies. Here, these are codes 882300 to 88299. Cytogenic studies address hereditary or genes at the cellular level. So, a chromosome study is an example. There are, of course, notes that you need to read. All right, almost done. Surgical pathology. This particular subsection contains codes that are used for a gross examination of a specimen. Gross is like with the naked eye. And gross examination involves the collection of a specimen that is bigger than a cell. Microscopic examination may or may not be necessary for the pathologist to determine a diagnosis. So it just depends on what they want to do. Um, when you look at these codes in the CPT manual, you will note that there are 6 levels of gross microscopic examination. And these codes are organized based on the site of the specimen and how they actually got the specimen. So pay close attention because you may see a body part reported more than once. But the question is, how did the surgeon get that specimen? Then the rest of the sections contain these 4 areas that you see here and where we started. And we are done. I'll be back with part 3 for week 7, which is the medicine section.